Second video on patellofemoral pain syndrome. The first thing we're going to go through today is training error. Esquiliar et al. Recently did a study comparing different approaches to treating people with patellofemoral pain syndrome, including strengthening, gait changes to improve loads with running, and then also education. And basically, education goes a long way in reducing the risk of this problem and also reducing the problem itself. So the first thing we're going to talk about is training consistency. So basically, volatile training, where we constantly are spiking how much or how hard our running is, up and down, is basically a recipe for disaster. We'd much rather have consistent training where we are able to train, recover, and repeat, and do that over weeks and months at a time, rather than this volatile training. The next thing is intensity. A common principle is a hard, easy principle, and most coaches agree that most of our running needs to be easy, with a few select days per week at most dedicated to being a harder type workout. So a good rule of thumb is 2 to maybe even 3 minutes slower than 5K pace, and that should constitute the majority of the running. The next idea is volume. This is how much we run. So significant spikes in the amounts of running over a short period of time is not a good idea. So slow progression. A common rule we hear about is the 10% rule. So say you're running 10 miles per week, it's a good idea to just increase by a mile or two per week at a time rather than a whole lot more than that. And then the last thing is surface and other course considerations. Downhill running does increase the loads on the patellofemoral joint, so it's a good idea if you're having this type of problem, maybe getting on a flatter terrain. And then also just softer surfaces are just generally kinder and often accepted better by runners. So it's a good idea to mix up the surfaces, get on dirt or trail or just service road intermittently.